Hello, everyone. I am Beth Jarris, Vice President of the Association of Public Data Users and a researcher at the Population Reference Bureau. I want to welcome you all to this rapid response webinar, co-hosted by AppDo, America's Data Index, and PRB. Given the pace of changes in data across the federal government, we started a new series for raising awareness about potential risks to public data and, most importantly, how you all can take action. We'll be sharing some specific actions today, and we'll follow up with information via email at the conclusion of this event. We have just 30 minutes together today, but if you have questions, please put those in the Q&A box. If we have any time left before the top of the hour, we'll try to answer a question or two. And if we run out of time, we'll include as many answers as we can in our email follow-up. Next slide, please. And today we have an all-star panel. Each of our panelists holds multiple distinguished roles, but since we have just 30 minutes, I'm going to highlight just one for each of them. Mark Mather is Associate Vice President of Population Reference Bureau. Norma Coe is Director of Policy and Economics of Disability, Aging, and the Long-Term Care Lab at the University of Pennsylvania. Denise Ross is former U.S. Chief Data Scientist, and Megan Morey is former Senior Advisor for Data Policy at the White House Office of Science and Technology Policy. And together, they'll walk us through the highlights of what's in the Medicare Current Beneficiary Survey, why the survey is so important, what are the risks, and what you can do to support this essential resource. So what's in MCBS? Mark, I'm going to start with you. Can you give us an overview of what's in the Medicare Current Beneficiary Survey?
Yes, thank you, Beth. There are some things, some aspects of the MCBS that really distinguish it from most other health surveys. So I'm going to provide this quick who, what, where, when, and how for this data resource. So MCBS, it is a nationally representative sample of Medicare beneficiaries. It includes people who are 65 and older, but also some folks who are under age 65 with disabilities. It oversamples beneficiaries who are Hispanic or Latino, people with disabilities, and also those who are ages 85 and older to get better representative data for those smaller population subgroups. This is a longitudinal survey on healthcare use, access to care, charges and payments, insurance coverage, and many other health topics. And it covers all these topics by combining survey data with administrative record data from the Medicare program. So that's really what makes it kind of unique. There are 3 limited data set files, and then there are 2 public use files that are released annually. And so the limited data use files, what that means is that the data do contain beneficiary level protected health information and require a data use agreement to access them. So researchers can access those files if they go through the process of putting together an application and getting that approved for research purposes. But again, there are also these public use files that are available for people with no data use agreement needed. The survey is administered nationwide with separate community and facility components. And what that means is that it includes beneficiaries who are living in the community as well as those who are in long-term care facilities. And the nice thing about that is since it's a longitudinal survey, it means you can track individuals who are moving between those different places. So moving from the community into long-term care, for example. The survey has been conducted continuously since 1991. Respondents are interviewed 3 times per year for 4 years, totaling up to 11 interviews over that period. So that means you're getting 4 years of data from the same beneficiary. And then there's also a new panel added each fall. And as you can imagine, the Medicare beneficiary population, it's a big group. So there are over 60 million people with Medicare coverage, and that's up from about just over 30 million back in 1991 when the survey began. So it's really great to have this trend data available as the population of beneficiaries has grown and changed over time. And then finally, this survey is sponsored by the Centers for Medicare and Medicaid Services, CMS, and they conduct the National Opinion Research Center at the University of Chicago conducts this survey. It includes about 35,000 interviews each year. And they use both in-person and CAPI data collection, CAPI standing for computer-assisted personal interviews. So thanks. I'll turn it over to the next speaker.
Thank you, Mark. Now, Norma, I know you've spent a lot of time thinking and researching on how policy can affect health, especially for older adults. Can you tell us why the Medicare Current Beneficiary Survey is so important?
Sure. Thanks for having me. First, it is the leading source of data among Medicare beneficiaries. It's hard to compete with the size as well as the breadth of information that's in this survey. It provides insights that aren't available in administrative or claims data because we can actually get measures such as out-of-pocket spending, as well as health status and satisfaction with services, which can only be gathered through survey. It does do important work in terms of supporting CMS in administering, monitoring, and evaluating Medicare. And as I mentioned, the breadth of information that is covered really allows comprehensive estimates of service use and expenditures. Next slide, please. If you do a quick search, I found almost 400 papers that were published, or almost 500 papers that were published last year using the MCBS. I will not bore you with 490 some odd papers. So here's just a quick smattering of different topics that have been researched using the MCBS. And so first is healthcare access. Right, what are the barriers among beneficiaries with different disease profiles or different conditions? It's been used to study nurse practitioner scope of practice and the importance of what are these rules in allowing or are regulating nurse practitioner authority that varies based on the state. And then more recently, looking at what happened during the COVID-19 pandemic and how much care was skipped or delayed because of the initial response and uncertainty to the COVID-19 pandemic. Next slide. We also have used it, researchers have also used it to look at healthcare costs and spending, such as out-of-pocket spending and how much people are spending on healthcare, even when they have Medicare coverage, and how much does that out-of-pocket spending mean? You know, what is it relative to the actual income that older adults have? And then there's been a big transformation within Medicare, moving from traditional fee-for-service model to a Medicare Advantage model. Now there's more than 50% of Medicare beneficiaries are in Medicare Advantage plans. And there's been a lot of work using the MCBS trying to compare and contrast the different incentives and the different outcomes that come in these two different systems within the Medicare program. Next slide, please. And then finally, policy and evaluation and program impact. There was it's not new anymore. It's been around for a while now, but, prescription drug coverage was introduced in the Medicare Part D program. And what happened? We needed the MCBS in order to really look at how adherence and cost non-adherence changed with the introduction of this huge benefit. And then how has it changed over time? And as I mentioned, MedPAC, ASPE, CBO, CMS, they're all using the MCBS on a regular basis in order to evaluate utilization, access, and spending, and then using that analysis to shape policy reforms going forward in order to do their work and make their recommendations. And I will turn it over to the next person.
Thank you, Norma. Very clearly an important data source. And Denise, I know you've been keeping an eagle eye on threats to public data. Could you share your assessment of the risks?
I can. So I've been reading the tea leaves on this fabulous data set. And in the bodes well column, it appears that staffing and budget are okay for now. The budget went down to 18 million from 20 million last year. But very encouragingly, CMS staff are engaged and they're looking to the future. They want to make sure that the survey is more flexible and responsive, and they're interested in developing state level estimates. So that's the good side. Next slide is what bodes less well. We will likely be losing questions on gender and experiences of discrimination. And as we've seen with other high-profile data sets, if the data reveal that satisfaction rates, health outcomes, or other performance metrics are declining, this data set may become a target for political intervention. And then lastly, I'm not sure how to interpret this one, but I thought it was worth putting out there. The budget, this year's budget talks about reducing contractor spend. No, they're $2 million down this year through things like strategic insourcing and the use of AI to improve productivity. So that'll be one to watch to see how those methodological changes work. So with that, I will pass it on to Megan, who I think is going to give us some more detail on what's happening with the gender and experiences of discrimination questions.
Exactly. Take it away, Megan.
Awesome. Fantastic. If you can pop to the next slide. So Denise just gave you a little bit of an overview about the changes that are being made to the survey. I summarized them here for folks. If you want to find more information about exactly what's changing, you can find that on reginfo.gov, where there's a detailed document describing each of the changes in turn. But the short version is they are revising the sexual orientation question. They're removing questions on gender identity. They're revising the question on respondent sex, basically to align with the administration's executive order requiring that agencies only allow people to respond with male or female response options to those questions. And they're removing an item about perceived discrimination from the component of the questionnaire that's about satisfaction with your care. And right now, that question asks about whether you perceive discrimination from your healthcare provider on the basis of a lot of things, including race and ethnicity, language or accent, gender identity, sexual orientation, age, culture, religion, disability, medical history. All of these sort of traits might be things that make folks feel as if they've been discriminated against on the basis of. They're removing this question altogether, and I think that will be it'll make it very tricky for us to understand whether or not people are able to get the care they need and what they think the barriers are to that care. And that question, I think, we're in a position to potentially have an impact on whether that question gets removed. I think many federal agencies right now feel as if the executive order on gender ideology really requires them to make these changes to the gender identity and sex questions you see here, but that shouldn't have an impact on their ability to collect data about perceived discrimination. So I want to strongly encourage folks who are on this call. You've heard how critical MCBS is, and I'm sure you know that from your own work, to submit a public comment. You can do that using the links that we've put in the chat here. And I just want to say, as a person who's submitted roughly maybe 1,000 public comments in my life, they can run the gamut. If you are an expert who has used MCBS in your own work, feel free to write a detailed public comment explaining how you've used the data and how these changes might harm your own work. But if you're a person who isn't even a technical expert, but feels like these data are beneficial, you can write as little as one sentence or one paragraph in response to this request from public comment from CMS. And we have seen many, many times, even in this administration, that those public comments really do make a difference. The federal agencies have responded to public comments by reinstating questions that they recognize that the public really wants to see, continue by reinstating whole surveys, and by making other technical changes to documents and to policies. So really encourage y'all to submit a public comment. You have about 9 more days to do so. Comments are due on September 12th. And if you would like to keep kind of in the loop about things that are going on other than the MCBS, if you go to the next slide, on America's Data Index, we're tracking all changes to both Federal Register and information collection requests that are posted through reginfo.gov. Go there, check it out, and please subscribe to our newsletters, which provided updated information to you on a weekly or more basis. And one more slide for us here. You can also join the Federal Data Forum, which is a space where those of us who really care about federal data policy are exchanging information when we have it about changes like these. So I'll toss it back to you, Beth.
Thank you so much, Megan. Highly encourage you to follow Data Index, sign up for the newsletter, and join the Federal Data Forum, because as we have events like this, like the rapid response webinars, we will share them out through those networks. In addition to all of the ways that Megan described that you can respond through the comments to the Federal Register, as we were preparing for this rapid response webinar, there is an interesting opportunity that came up. Staff from CMS reached out directly and offered to chat one-on-one with anyone who's interested in working with the data. So when Denise said staff are engaged and want to improve the survey and be responsive, we really truly mean it in this case. It is a delightful and increasingly rare thing these days to have federal agency staff say, we want to hear, we have the time and the energy and we want to hear more from the public. So when we send out the email follow-up to this meeting, we're going to include the staff person's contact and encourage you to reach out if you have questions, if you want to understand the changes that are proposed for the survey, or what question or what responses, like, yeah, we really would like state level data, that would be helpful. Please reach out to staff. That information will be in the email, and take advantage of that very generous offer that they have made, because we don't get offers that generous all the time, and I want to take advantage of that and recognize that the CMF staff have just been wonderful to work with. And I also want to thank all of our panelists for sharing their time and experience with us today, and take a moment to see if there are, because we wrapped in record time, and we do have a couple of moments for questions. I see a comment in the chat. I don't know if everyone can see it, but it looks like they can, that Naomi Goldberg from MAP is working on a sign-on letter. And if you want to participate in that sign-on letter as well, you can reach out, and the contact information is there for you. Does anyone else have any questions? I see one in the Q&A. The question is, and I don't know if I know the answer to this, but maybe Denise or Megan, you might. It's, are there specific statutory obligations or civil rights laws that would be undermined by removing these MCBS questions? And I think they mean the ones on discrimination. That would be helpful to uplift in the comments.
Megan, I heard you have a law degree.
It's true. And I think, you know, the Affordable Care Act, of course, prohibits discrimination in health care provision. So I think that would be something you might want to address. And I think you might also want to address Title VI of the Civil Rights Act, which prohibits discrimination in federally funded programs. So Medicare is a federally funded program, and that might be something you want to touch on. But I think that we also sort of need to recognize that each of those items that the perceived discrimination question addresses kind of ties back to a different underlying civil rights law. So if you're most interested in discrimination against, for example, people with disabilities, you might want to touch on the Americans with Disabilities Act and the like. So you might want to mix and match a little bit based on the data that you might be most likely to use.
Any other questions or comments? All right, not seeing any. I want to take a moment to thank again, all of our panelists for sharing their time and expertise with us today. I want to thank all of you listening in for caring about public data. And as a reminder, if you missed any of the links, and just so you get that contact information for CMS, we will be sharing slides, the list of actions, and the webinar recording very soon. So now go submit your comments.